Salam Sejahtera. I'm Sivasangari Genapathy, and today my presentation is on behavioral studies on Knowlesi Malaria among at-risk group in Peninsular Malaysia. Plasmodium knowlesi, a zoonotic malaria parasite which remains a serious occurrence in some at-risk communities in Malaysia. Although there are a large number of studies in this area, in the Malaysian context, many studies focus on Sabah and Sarawak, and that too in clinical context. Studies that focus on Peninsular Malaysia or studies that investigate this matter from social sciences point of view are still at scarce. However, there is evidence to show that behavioral changes can bring about a good impact in combating Knowlesi malaria. To combat this, the interaction between agent-host environment needs to be interrupted. One way, as host, humans can interrupt this interaction is by increasing their health literacy, improving attitudes, subjective norms, and perceived behavior on Knowlesi malaria. The correct health behavior will help control the transmission of the disease. Hence, this study focuses on exploring behavioral factors in overcoming Knowlesi malaria in Peninsular Malaysia. So, what is malaria? Malaria is a life-threatening infectious disease that's caused by Plasmodium, a protozoan parasite. There are 4 types of Plasmodium species that can infect humans, which are Plasmodium falciparum, Plasmodium malariae, Plasmodium ovale, and Plasmodium vivax. On the other hand, there are also a Plasmodium that's called Knowlesi, which generally infect animals but can infect humans on rare occasion. Data shows that 125 million travelers universally visit over 100 countries and territories where malaria is a danger. Besides that, infections with human Knowlesi have been reported in practically all of Southeast Asian countries and visitors returning from these countries. From 2004 to 2015, the Southeast Asia region has had 3,413 Knowlesi malaria cases, where Malaysian Borneo accounting for 91.47% of all cases. Malaysia has the aim of becoming malaria-free country, and this continuous rise in the Knowlesi cases poses a great threat to malaria management in Malaysia. Currently, the most common malaria infection in Malaysia is the Knowlesi type of malaria. Although a large amount of cases in Malaysia were previously attributed to Sabah and Sarawak, the recent surge in the number of cases in Peninsular Malaysia is alarming. From 113 cases in 2015 to 598 cases in 2018 is a serious number. The long-tail macaque and the pigtail macaque are the 2 types of monkeys in Malaysia that considered to be the all-natural reservoir host for the Knowlesi Plasmodium parasite. Like how the macaques are acting as the host, these Anopheles types of mosquitoes have all been implicated as the vector for the Knowlesi malaria. Some factors contribute to the increasing number of Knowlesi malaria cases are fewer human malaria cases, which diminishes relative immunity, the close proximity of people to natural reservoir hosts or infected vectors due to changes in human land use. The presence of monkeys in the area was found to be a substantial predictor of risk, implying that monkey to human transmission is still the most common mode of transmission rather than human to human transmission. If we look at some of the studies that has been conducted on Knowlesi malaria, one of the study which was conducted in Sabah between 2012 to 2015, specifically on individual factors, finding shows that men were 4 times at risk compared to female in having Knowlesi malaria infection. This is mostly because women They mostly carry out indoor work such as shopkeeping, traditional female household duties, studying, and etc., which are all associated with a lower risk of Knowlesi infection. In addition, humans working on the fringes of forests or even in the forest itself are at higher risk of contracting Knowlesi malaria when they carry out their activities. Secondly, if we look at studies that focus on environmental factors, risk factors, finding shows that agriculture sector contributes to the highest number of cases with 82.2%, followed by the forest-related activities such as logging or collection of forest products that comes to 17.5%. In another study in Sarawak, study shows that Anopheles latent type of mosquito prefers to feed on humans and macaque at ground level, when in higher elevation they prefer to feed on macaque more than humans. Additionally, the humans who live in mountainous area are at higher risk to get infected. On human vector interaction factor, studies shows that close proximity to the forest as a significant risk factor, as most of the traditional villages in Sabah are located is either near the forest or forest edge, and the source of income is usually related to forest products, thus increasing the chances of human vector animal contacts. So the research gap that was identified for this study is that studies on Knowlesi malaria in social sciences context are scarce. At the same time, as mentioned before, studies on the at-risk group in Peninsular Malaysia are also scarce. Recent works by the healthcare workers, researchers, academics, policy writers, and clinicians has begun to recognize the importance of identifying contextual factor that influences health, and in this case, we investigating the health behavior in order to combat the Knowlesi malaria cases in Peninsular Malaysia. So these are the research gap that has been identified for this research. In order to create a successful malaria prevention strategy, it is important to understand how humans respond to malaria in general, their behavior and social barriers, how they accept the prevention measures, how they perceive the control strategy, how they perceive the whole situation, how they perceive the health seeking and treatment behavior. These are very important. Besides that, it is also will help to create a more effective health communication strategies for malaria and the promotion of early and effective treatment of clinical cases of malaria. Moreover, behavioral expectation is basically the subjective probability of performance of certain activities. It accounts for additional influences such as the circumstances of that person and his or her past behavior, as well as anticipated changes by they themselves or those surrounding them. So this brings to the question of what theory is being used for this study. Some of the common theories that is used to study health behavior are health belief model, the theory of reasoned action, and the extended parallel process model. These theories worked based on the assumption that human behavior is guided by internal cognitive process and that individuals have the power of acting on their own volition based on rational and cost-effective evaluation. However, the current study adopts the integrated behavior model, which was developed by Fishbein in 1998. It is a model that was developed from the extension of theory of reasoned action by Fishbein and Azlan in 1975, and theory of plant behavior by Azlan in 1991. The IBM is considered to be one of the most popular health behavior theories and considered to be a well-established model in studying health behaviors. Besides that, another key difference of IBM compared to the theory of reasoned action and theory of planned behavior is that it has integrated other components that affects behavior, which are knowledge, salience of the behavior, environmental constraint, and also the habit. Besides that, this component is also thought to be able to predict behavior across a different population. Another advantage of IBM is that it operates on the assumption that the relevant behavior outcome, reference, and self-efficacy beliefs will differ from different population and also their behaviors. As mentioned earlier, this is a quantitative study. So in order to develop instrument, an in-depth interview was conducted on 15 individuals who has not been infected with Knowlesi malaria but they were from at-risk areas. In this case, the sites that was chosen for the interviews are Kelantan, Musang, Pahang, Kuala Lipis, and Perak, Kampar. This step was considered to be very crucial to identify the relevant behavioral health outcomes, reference and environmental barriers, and facilitators for malaria health prevention behavior and the population under investigation. So the following 5 factors were identified as the result from the in-depth interview, which are consuming prophylaxis, wearing a shirt and long pants when doing outdoor activities, using mosquito repellent on skin and clothing, using mosquito net while sleeping, and using mosquito repellent coil. So, questionnaire was developed based on the in-depth interview that was conducted on the 3 at-risk areas and based on the factors that was identified. And a pilot study was conducted in Kuala Selangor, and further amendments was done on the questionnaire. For this study, we used universal sampling for cases, and controls are randomly selected and matched to the same locality as cases. Interview guided questionnaire is used to collect data. The questionnaire consists of 5 sections. Section A being social demographic section, and section B is for risk factors such as environmental factor, human mosquito contacts, cultural control activities, and etc. Section C is on prevention behavior, section D is on health knowledge, and section E is on health literacy. Only laboratory confirmed cases on Knowlesi malaria notified from the selected study location was selected. The study targets 200 cases and 4 controls for each cases, and that brings to about 1,000 respondents for this study. These are the inclusion criteria for the data collection. The inclusion criteria for the case are as below. All patients aged 18 and above with confirmed Knowlesi malaria within a study location, primarily resided in the study area minimum of 3 weeks for minimum of 3 weeks. The inclusion criteria for controls are no history of fever and tested negative for malaria, locality matched to the cases, primarily resided in the study area for minimum of 3 weeks. The following are the exclusion criteria for both case and controls. Non-Malaysians, aged below 18 years, previously recruited as a case and previously recruited as a control. As for the enumerators, health officers from each selected locations were selected as enumerators. Selecting enumerators from the local health department, especially from the vector division, was helpful as they are very well versed about the local community and also their dialects. So it was easier for us to communicate with the local community because they are familiar with the health officers there. And the health officers were also slightly more knowledgeable about the vector and malaria in general. We conducted separate online briefings for enumerators from different districts on each section of the questionnaire. We also briefed this enumerators on the ethical obligations during the data collection process as well. As for the research location, we have chosen 4 districts with the highest number of Knowlesi malaria cases, which are Musang, Kelantan, Kampar, Perak, Kuala Lipis, Pahang, and Kota Tinggi, Johor. For the first round of data collection, a team from University Kebangsaan Malaysia, we went to assist the Musang team of enumerators in Musang. We mostly went to Kampung Orang Asli. They mostly stayed at the mountainous areas and fringes of forest, and we find it quite challenging without the help of the local health officers there due to language barriers and cultural barriers. We also had to ask them some probing questions. Since it's an assisted questionnaire, we thought it's useful if we ask them probing questions to gauge answers from the respondents. Sometimes we also had to use the local dialects, like for example, for one of the questions where it required them to answer if they use mosquito repellent. They don't understand what does it mean by mosquito repellent, so we had to use their local dialect to say that ubat nyamuk. Then they understand what does mosquito repellent means, then they could answer us. So we had to use some local dialects. Like another example would be when we asked like if they use mosquito repellent sprays or creams. They didn't understand what does it mean by that, so we had to say it's TYT. TYT is a local cream that they use to prevent mosquito bites. So these were the some of the techniques we had to use to gauge answers from those respondents in Musang. So these are some pictures that we took with the UKM team and also the enumerators, and some of the pictures also shows the respondents from the Orang Asli, Kampung, and also other areas. Each respondents were given hand sanitizer and a pack of masks as a token of appreciation, and they also signed a consent form before we started doing the questionnaire. So ultimately, we want to develop an intervention module based on the data that we collect from the 4 locations that I mentioned earlier. The education module will address the barriers to prevention behavior, and a highly customized module formulated for the unique culture, traits, and belief of the community under study. The aim of the module is also to encourage prevention behavior intention for Knowlesi malaria among the at-risk community in Peninsular Malaysia. Beside the intervention module, the study also aims to come out with an intervention program. However, it will only be done after the data collection process is over. The proposed program will be highly dependent on the outcome of the data collected, and at this stage, we aim to organize this intervention program in Musang. This study is part of the long-term research grant scheme, the LRGS project, which is titled Social Behavioural Study, a multidisciplinary health intervention approach to improving Knowlesi malaria health behaviour among at-risk population in Peninsular Malaysia. So here's a special thanks to Dr. Emar and Dr. Anis for this opportunity and continuous guidance. So thank you for your time and appreciate all the attention. Thank you very much.